Before sunrise, patients leave their home to start their journey towards healthcare in Fond-des-Blancs. They ride on the back of motorcycles, donkeys, to get to the hospital. They come to our hospital in Fond-des-Blancs because they know it has a reputation of providing 24/7 high-quality care at no charge. Patients line up at the entrance looking for compassionate care provided with dignity and excellence. They gather in the waiting area, and over the time, we have had, on average, 500 patients a day, and 50% of our patients come outside of our immediate catchment area. We are the largest healthcare provider in the southern region. From the waiting area, they go see the doctors or to the emergency room if it's needed.
So we went up the path and we're going into the emergency room now. This is our newest building. It was actually built by some people here, Build Health International. And we're gonna follow Miss Genevieve as she goes back into the ER here. The ER is one of the busiest places in the hospital. There's all the beds are always full. It's open 24/7. We have over 9,000 patient visits a year in this facility, and it really provides some of the most critical care in the hospital. Day or night, 365 days a year, our ER is functioning like an ER here in the US. What's really exciting as well about our emergency room is that we have the first Haitian-trained emergency medical residents who are now rotating through here. And we're getting trained residents from all over the country through all of our services. We're now going to leave the ER and head over to the lab.
Our lab has grown in accordance with the hospital in size and in the quality of services we are providing. So we test for the routine conditions, but we also test for the emerging diseases like COVID-19. So because of the sophistication we have in our lab, right now we are also training technicians to really acquire the skills they need to work in the labs in Haiti. We are also in partnership with the National Lab of the Ministry of Health to track health trends in the southern region. We try to deliver the test results the same day in order for our patients to start their treatment early and to return home. Now, let's go to the NICU.
So this is our neonatal intensive care unit. It has 50 beds. A 50-bed NICU is actually bigger than the NICU in Boston Children's. So this is a massive NICU on par with major teaching hospitals in the United States. We have over 1,000 neonates go through our NICU every year. And as you can see, we're providing quality care throughout. One of the things that's amazing about our NICU is we're getting patients from all over, 6-hour drive, 7-hour drive away, and even landing patients in a helicopter down the street from the hospital in a mango field where patients are coming from throughout the country to get care. This is Miss Pascal. Miss Pascal runs our NICU. Miss Pascal always talks about the importance of quality care, but also care with compassion. She always talks about making sure that she's singing to the babies as she provides care because it really shows compassion and makes sure that the babies feel that they're loved while they're in our NICU. You can see also there's all sophisticated equipment here. It's run by Haitian biomed technicians who've been trained on making sure the equipment continues to run. We're now going to head over to our surgical center.
We are willing a patient for surgery. Our surgical pavilion has a 3 operating room suite, and it has become a great addition for the community because we are enclave and isolated. We all hope to live our life without needing any surgical care, but when we need it, we gotta have it. So our surgical program at St. Boniface Hospital is unique in the sense that it provides high-quality surgical care at no charge. And surgical care is scarce in Haiti. When you have it, it's very expensive. We are also a training center for surgery residents from Port-au-Prince, nursing students, medical students. 30 years ago, I had to refer a patient for strangulated hernia on a 6-hour drive to Port-au-Prince. Today, we don't need to do that. We have highly trained, skilled Haitian surgeons to provide that quality surgical care.
We're now heading over to the Spinal Cord Injury Center. We're following one of our patients, Casimir. On the left, were all of our inpatient beds, so we have 16 beds, but we're gonna head over to the right and go into our gym in the center of campus. This was started after the earthquake in 2010, where our board and our team on the ground in Haiti decided we really needed to create a national center for spinal cord injury because there wasn't one before, and there were so many injured patients who needed this care. So we started from scratch this center in rural Haiti, started landing patients with in helicopters, and now have treated hundreds of patients. In our spinal cord injury center, we don't just do the clinical care and the rehab, we also have psychosocial support, job training, really making sure that people feel independent when they go back home into their communities. And we're not only doing spinal cord injury care, we're also able to do physical rehab for other patients as well. We're gonna head back out through the waiting room and then out into town and onto our warehouse.
Here we are at our warehouse, the big one. We have learned over the past earthquakes that it is necessary, very important, to have supplies in quantities to provide the timely response during times of emergency. So we are trying to get a 6-month supply throughout the year, and as we try to strengthen our supply chain system towards self-reliance, we are often asked to help other health facilities in the region and help them with drugs and medical supplies in times of disasters. So for us, it is very important because if we are not able to treat our patients with the drugs that they need, they have to turn to the local market and buy those medicines at prohibitive costs, which they cannot afford with their meager income. So we are trying to keep our warehouse full all year long to really meet our mission. So night is falling down in Fontainebleau now, as you can see, but we'll fast forward several hours for you to have an idea how incredibly busy the hospital is all night long.
Yeah, and as you can see, we're outside the maternity center, and you can imagine just how many deliveries are happening in the middle of the night. And the hospital is open 24/7 to anybody who comes through our doors. We also have 24/7 care throughout the hospital and lots of family members constantly coming through. We're really proud to show you our hospital. What started as a vaccine campaign and then a one-room clinic now has become this hospital, and we've been able to expand into regional work throughout the Southern Peninsula as well. We have an incredible local staff that's providing all this care, and we're really proud to get behind them in the work that we do.